So for the last quite a few months, we have actively engaged with our clients and with our client, and then we have been actively developing the IPD module. And there are certain features, what those features are specific to our clients, so we have kept them behind toggle. Otherwise, there are generic features which will be merged with the product. So we are still working on them. We have gone live recently with one of the countries for our client, and the subsequent phases will be coming up, for which we are continuously working to develop the new features in for the IPD module. Today, our team member Astha Shruti, she is going to demonstrate to you what we have developed so far, and we will be glad to receive any comments, questions, advices, and suggestions. Astha, over to you.
Thanks, Amit. I'll share my screen. Yeah. So once the IPD visit has been started for a patient and the patient has been admitted, so the doctor will first prescribe the medication for the patient that they can do through the medication tab here. After that, the nurse will go to the inpatient module. Sorry. Yeah, and click on the patient identifier here to open the IPD dashboard for that patient. So the IPD dashboard contains the first of all the patient header with the patient details as well as the bed number assigned to it. We can also see various details of the patient such as the address, contact details, and the relationship. We also have the patient dashboard and visit summary link, which opens in the targeted tab, the patient dashboard. After that, we have the vitals and nutritional values. We can see and if any vitals or nutrition values are captured for that patient, and we can also see the vitals history from here. Like if, for example, for a patient, vitals needs to be captured every day, so we can see the history, or every few hours we can see the history from here. Then, if any allergies or diagnosis has been captured from the patient, we have the allergies and diagnosis display control, which we can also select from the left panel. After that, once the doctor prescribes the medication for that patient, the medication will come up here in the treatments display control with that RX tag. And this notes icon indicate that some instruction has been captured for that patient, and here we can see the instructions and additional instructions added. The drug will be highlighted until they are scheduled, and will have the add to drug chart link attached to it. So this medication is scheduled for frequency 3 times a day. So when the current time is in like after this already scheduled times, which is the default values which we have added according to different hospitals. We have made it part of the config. So the current time is after 1400 hours. So the first two slots will be disabled, and that number of slots will be added in the remainder time schedules, and the subsequent time will remain constant. So the nurse can also come here and add some notes. I'll add some notes here and click on save. And after clicking on save, the nursing task and the drug chart will refresh, and subsequent cards will be added for that particular drug. For example, 2200 hours this was added, so we have the card in place for that. So the nursing task section contains the each placeholder card for each medication task, which is present for one shift. For example, right now we have the shift timing 1900 to 7:59 hours. We can also navigate between different shifts, and we can navigate to two shifts in the future date and to the shift where the patient got admitted. Also, the nurse can also filter their tasks based on all tasks completed, pending, stopped, and skipped. And the nursing tasks will come up in the ascending order of the time with which they should be administered. So right now, the nurse can click on disk, and since this is in a future time, this is disabled. But I will add another task. So when the frequency is, something like 6 every 6 hours, in that case, we need to ensure that the difference between the timing of the medication dosage given is should be maintained. So we only add the start time here and not the schedule times. For example, if I add 10 a.m. as the start time, so based on the start time and the frequency, a number of subsequent tasks tiles will be created for this medication. Uh, just a second.
Yeah, Asta, probably you can add another medic. Yeah, you can change it to
Yes.
probably
Like,
1930. Yeah,
yes.
1930 you can make it. Yeah. Asta, you see the first
Yes.
tile, right? That is, yep.
Yes.
You can click on it.
So we have the relevant and non-relevant task. This one is highlighted so that the nurse can know that this within half hour she has to schedule this, administer this medication. So then the nurse can fulfill the task by updating the task with the administered time and some notes. And when we click on save, then we can see it. The drug has been administered, reflected in the drug chart. So this is the drug chart. Here also the nurse can view the current shift as well as navigate to the other shifts. On the left panel, we'll have the list of medications, and on the right panel, we'll have this legend icons, uh, where the at the time when the medication has been administered. So when we click on this legend icon, we can see that this medication has been administered at 1909. And we can also see the notes which we add while administering the medication. So these are the few legend icons. For example, if we have added a medication and not administered it, it will show as pending. But when the current time is past that added time, then it will show as late. And similarly, since we have administered this medication, it will show as administered, and not administered and stop workflow I'll show. So in some case, what happens is if not this one, I'll just add one more medication for this patient for sure. We have a few other scenarios with different types of medication tasks. For example, when a situation can arise when a medication needs to be administered immediately or within 30 minutes of it being ordered. So the doctor can then prescribe a immediately medication, and when this is prescribed, the duration is automatically taken as 1 unit, and the units are automatically taken as one occurrence. This one we cannot change. So I'll add a start immediately medication. Okay. So once we refresh the drug chart, the IPD dashboard, we can see in the treatments display control, the RX stat medication is displayed by the RX stat, and we can add the start timing. I'm adding it as uh, 100 hours. Yes. And suppose suppose the situation arises that the nurse needs to skip this particular drug at one time, maybe because the patient is taking some other drug and it cannot go with this. So the nurse can click on here and skip the drug and add some skip notes like why they are skipping the drugs. And when we click on save, in both of the nursing task and drug chart, uh, it is coming as not administered. And here also we can see the drug has been skipped. The next scenario is when the doctor foresees that the patient needs and can need a medication in the future and prescribe a PRN medication, which can be prescribed only administered only when the situation arises. So I'll add one more medication here for 2 days, and I'll check this box to mark it as a PRN medication. So in the treatments display control, we see the add PRN task link, and this doesn't have any timing associated since we cannot schedule a PRN task. So we'll just save this PRN medication, and a subsequent placeholder card will be created in the nursing task display control for this particular time shift. So the nurse can then go and give the PRN medication to the patient at any given time. And what will happen is the card will remain as it is because it can be given any number of times in a day. But when we see the completed medications list, we see the PRN medication task has been given, and also here the medication has been prescribed. Then the next scenario is if a patient becomes intolerant or allergic of any medication, then we might need to stop the drug. So in this case, we see the drug button. The nurse can click on this and give the reason to stop the medication. And all of the remaining slots, cards, or the medications will be shown with the stop sign. For example, we can see it here in the drug chart, and in the nursing task also, it will be coming as the stop drug. Uh, the other scenario is sometimes an emergency situation can arise that the ward nurse can need to give an emergency medication to a patient, but probably the doctor is not there to prescribe the medication, or the nurse can discuss with the doctor over the call and just prescribe a medication and administer it at the same time. So in this case, we have this add emergency medication workflow. So the user can add the provider which they requested from, and also which they consulted from, and they can also add some notes of why the emergency medication is needed, and click on save. And in the treatments, it will come up as given and with the provider name, and the status will be shown as not acknowledged. So this provider can log in their system, and then they can also acknowledge this drug. In the nursing task and the structure display control, it will come up as completed.
Asta, just sorry to interrupt. So this acknowledgement workflow by the provider, this is specific to our client. They requested for it. So we'll be
Yes.
keeping it behind toggle. Yeah.
Yes.
I hope the page gets refreshed as soon as you add a task. Somebody does not have to actually go and read
Yes.
the page, right?
Yes. Yes. It automatically refreshes. I'll add one more emergency task. Yes. So after that, we can also discharge or move the patient to another ward from here. We can choose this option as transfer patient, and once we click on save, it will take me to the ward view, and I can move that patient to another bed. So we can see the bed of this patient has been changed now. Similarly, we can discharge the patient. Any questions?
Regarding the legends like late, administered late, right? So
Yes.
when those scenarios will occur, is there any property configured for this many hours later, it should be late and administered late like that?
That is correct.
Yes.
So we have a dosing window of 1 hour. We have kept it, and this is also configurable. So our client requested for 1 hour as a dosing window. So beyond that, it will be if the administered time is captured. So for example, if a medication has been scheduled at 8 p.m. and if at 9:01 it has been captured as administered, then it will be stated as late. So that's the dosing window we have kept behind configuring.
Okay, for example, if there are drugs which needs to be prescribed every 3 hours or 4 hours, okay. So in
Hmm.
those cases, how the cards will display here in this
Every
task?
3 hours and every 4 hours.
Yeah.
I will add a medication.
So the cards will be displayed, like say, if it is every 3 hours, for example. So, Asta, you can continue. So in this add to drug chart, in that slider, right side slider, we'll be having a start time. So for
Okay.
example, if I give the start time as 7 p.m. and it is every 3 hours.
Mm-hmm.
So what system will do, the first task or the first dose will be created at 7 p.m. Then 7:10 like that it will create until
Okay.
the duration of that prescription.
Mm-hmm.
And accordingly it will be showing in the nursing task. Again, there is a time window of say, as of now we have created this 1900 hours to 8 a.m. tomorrow. So
Mm-hmm.
accordingly it will be displayed in those time windows.
Okay, great. And the cards will be active once it is time to administer, right?
That is correct. So there also we have kept a configurable time window of 30 minutes. That is our client's requirement. So for example, for the next 30 minutes, whatever task are needs to be fulfilled, they will be active. I can click on them after administration and I can go there and say done in the toggle switch.
Okay.
For the task beyond the 30 minutes, the toggle switch will not be active. So I'll not be able to do it. That's to avoid confusion so that NARS accidentally do not update the forthcoming task as done.
Okay. Got it.
Just one more quick question on the UX side though. So can I select multiple tasks and then mark it as done?
Yes. No, like if the timing of the tasks are same, then in that case we can select multiple tasks. For example, if there is one other medication at the same time,
Mhm.
so then we can select both of them as done, and then we can save it.
Asta, you
Okay.
can quickly create one prescription and then with
Yes.
every 3 hours like that. And
Yes, yes.
yeah, so Asta, before clicking, just check one. You have to give a same time, right? So you have seen it.
Yes.
Yeah, yeah, 19.
So when we click on the task style, all of the medication for that particular time will come, and we can save both of them together.
All right.
Yeah, one more question, like, is this behind any privilege? Like, I can see it, options to add a task and then stop a drug or edit a drug, right? So is this behind any privilege? Like only a chief nurse can do this task, other nurses can only administer the drugs.
As of now, no, we have kept it open because
Okay,
that
so
is how, yeah,
all the users can do this
that's
activity.
correct. Yes.
Is it all the users or at least at a broad level privilege, like say IPD or something, or manage task or something?
Anshul, we have not added privileges to any particular task and action items, but to the entry point of this page, right? There are two entry points. One is from the clinical page of the patient, and one is from inpatient module. So any users who have access to these two modules will be able to access these. But the future plan is to also build, specific actionable privileges.
Yeah, I think that will be required because a word view might be seen by many, for example, right? Even an administrator.
Mhm.
But some of these actions, for example, administering a drug, right?
Yes.
Anything that directly affects patient's safety,
Mhm.
right, must be guarded, right? And with specific privilege. Like, for example, administration of the task, marking a task as like, say, oh, not done, skipped, right? Scheduling, like, say, a specific task. These directly can affect patient safety, right?
Yes.
So this must be guarded through specific privileges.
Got it. Thanks, Anshul.
Right, and maybe you want to consider even a broader level privilege, like say, oh, IPD, for example, or manage drug chart or something of that sort.
Yeah, at least a broad level privilege should be there, like manage drug chart or manage IPD or something like that, which should be checked at every action,
Hmm.
because UI is not the only way actions happen. You can use an API and do an action, so that should be guarded at the API level, not just UI level.
Sure, Gurpreet. Yes, well noted.
Anything that you are directly affecting the patient safety should be guarded.
Right, and the other guard is the audit log. Are there any audit logs happening while all of this is going on?
Amit, you want to add? Not as far as I understand, not at the moment, but this is planned for the next upcoming sprint.
Yes, that's correct. Yeah.
Also,
All
just one thing,
all clinical
whether
action.
the data that is entered by a nurse, like she has given the medicine at so and so time, or the notes which she or he is entering, whether that is also cross-verified or validated, is there any such workflow as well to do this?
The notes which are captured by the nurses in certain cases, like for example, while scheduling the medication task and while administering the capturing the administered time,
Yeah. Mhm.
there is no validation workflow of that notes. We are just capturing that information if nurse wants to do that. If
Mhm.
that answers. However, in certain cases, we have kept the notes mandatory under certain scenarios, but there is no separate validation workflow for these notes as of now.
Okay.
Yeah.
Okay. So maybe just said earlier, once we capture the audit logs, then that can also be monitored and checked in case. Means that workflow can be used for this reason.
Yes,
I'm not sure.
yeah,
Okay.
we will
Okay.
be also discussing internally. That thanks for the input. Yeah.
Thanks. Thanks.
I think Sohail has a question. Sohail, you want to go ahead?
Yeah, thank you for this impressive task. So, just I have one small question. For example, if somewhere the system get interrupted, like the system get down for 30 minutes or 50 minutes or 1 hour, is that any consideration taken that all the schedule will taken into on the right track before system goes down and after system up?
So as of now, no. However, like if, for example, I hope it addresses your question. So for example, as a nurse, I have scheduled the medication task, and for 1 hour, because system was down, I was not able to update, although I was parallelly administering the medication. So I can always come back once system is up, and backdatedly I can enter uh, the administration time. So that way I'll be able to recover, I'll be able to, you know, uh, capture what I have left to capture because of the system downtime. I'm not sure if it addresses your question.
Yeah, it's somewhere, some sort of. Thank you for taking consideration.
The nurse didn't administer any of the drugs, then all the tasks will be marked as late, correct?
Yes.
And do they have option to edit it? I mean, after the shift task or something like that?
My understanding was that when you're administering them, when you mark as done, you're entering the time, right, Gokul?
Yeah.
So if you're entering the time and the time is correct, then they are
Mm.
not late anymore, right? They were late earlier when the
Okay.
system was opened, but once you entered the time as the original time or within the original time window, then
Mm.
it would say that it is fine because you entered it at the right time. So it will no longer show them as late,
Okay.
right? So they are late until you actually say, oh, no, no, I didn't, it's not late, I've just not entered it. So
Mm.
late entry is not the point, I guess, it's late administration.
Yeah.
Is that
But
correct, Amit?
Yes, Gopi.
yeah, I agree with that. But still, there could be a human errors as well, right? The human can enter some wrong time as well. For this future, we in Bahmni, we have the retrospective entry where we can just set a time like where we are going to do any entries. So it will also mark on behalf of so and so user. This has been done this time like that.
So
You're
if I
saying someone entered something, they likely made a mistake,
Mm.
didn't realize it that time. Then later, someone wanted to come and retrospectively fix what was entered.
Yeah.
Okay. I don't know whether that is handled right now.
So
Once something
whenever
is marked as done,
no,
it's right now just like
maybe you
updated.
didn't understand the question properly. Whenever action has been made in electronic systems, so the action date and time will be recorded, right? So here the
Yes.
user is manually entering the time.
Manually, optionally entering the time. Yes. It's
Yeah.
optional. The time is right now by default set to
Yeah.
now, but you can update it before you save.
Yeah. So
So I think if you update the time, it makes notes as a mandatory thing where you have to specify why you are updating the time.
oh,
There is
okay.
a configuration thing.
Mm.
Asai, can you change the time and see?
if
Yes.
it goes beyond the dosing window, then only the notes is mandatory.
Okay.
Like,
Not that we just, because what is going to happen, for example, let's say this has been scheduled at 1500 hours, okay? And I have gone through the medication administration round. I catered to 10 patients. I came back. I came back at 15:30 hours. So at that time, what I'll do is that I'll be changing it, of course, right? Like 10, 15, 15, 15, 10. Then every time system will enforce to capture the notes, but that should not be the case. That's why we have kept the dosing window of 1 hour. If you are for last 1 hour also, if you cannot update this, capture it in the system, then we'll be asking for the mm, notes. Otherwise, I will be definitely changing the uh, default system time from that field. Does that answer?
yes, and the dosing time, that 1 hour window is also configurable. We can change it.
Are
Quickly,
there
do we
any
have
other features that you are going to demo besides the drug chart and others? Just so that we understand from an IPD perspective.
Asta, maybe you can show the approval part where the doctor has to acknowledge.
Yeah, I'll log in as a doctor.
and while Asta does it, Amit, is there a provision for ad hoc medication scheduling? Like, for example,
Mhm. Okay.
medications that are not prescribed by the doctor. Imagine diabetic patient, I'm getting administered.
Okay.
I'm getting actually for a different sort of a diagnosis or treatment. All right. So the diabetes medications are not really prescribed by the doctor, so they will not come as an order. Typically, the patient would come and say, "This is the medications that I'm taking," or the nurses would ask, and they'll say, "Okay, you continue this," after they check with the doctor. So in that case, do you have any provision for it, or are you thinking about this?
Yes, Anshuman, so we do not have it, to answer you in one sentence as of now. So what our client is doing, Anshuman, is that even for the external medications, they are actually creating an in-house prescription, and that is coming in the workflow which Asta was showing. Other than that, if there is no prescription available, we only have that emergency or the ad hoc medication workflow, which is kind of not scheduling, but retrospectively telling the system, updating the system what has been administered. However, as you said, that workflow we have not done yet, but we can definitely discuss internally with the team, and you can definitely add it as another workflow.
Yeah, I think in your case might be the case, but typically this is a absolutely common requirement. In any decent size hospitals, this would be a very, very common scenario.
Sure, sure.
So when we log in as a provider, they can come here and see the notifications tab, and we can see like these users and emergency medication added for them. And for example, for this test user, I'll acknowledge this emergency medication. And when I go to this user, new patient one. Oh, okay, there must be a password. I'll just create one emergency medication for this patient.
The allergies is also a new feature that you developed, right? That is also not seen before.
That's correct. Yeah.
Asta, probably after this, you can show that also.
Yeah. So for this new patient, we have this paracetamol. I'll acknowledge this. And then this will be marked as acknowledged.
Asta, can you scroll down to the drug chart? Can you show how it looks when there are multiple medications?
Yes. When we have more than 10 medications, then we have the scroller and just a second. Yeah, we can move it like this. If it's down, it comes in the green color, and
So as
we
of
can
now,
scroll.
without scrolling, getting activated, we can show up to 10 medications in this list. Beyond that, if there are some more medications hidden below, then the bottom green arrow will be activated. Similarly, once we scroll down, the upper one will be activated.
Is the name of the nurse that sent the request not there in that acknowledgement?
No, Gurpreet, it is not there.
So if the doctor has a question on who added it and forgets it, who do they reach out to?
Yeah, that's a good point. I am noting it down, Gurpreet. Only thing is that but that is definitely not a solution. Like we have a link for the doctor to visit to the IPD dashboard. But yes, nurse name should be mentioned there.
Also, when we click on the orders module, we can see the IPD drug orders as a different tab. And once the medicines are dispensed for this patient, for example, this patient, then the patient gets removed from the drug order.
Yeah, maybe Asta, you can just show the allergies part.
Yeah.
Yeah, also, so we have added a new forms display control that you see over here on the right hand side called observation forms. So there are multiple enhancements made to this as well. So this is a React component, and right now, can you click on the vitals form, Asta?
Yes.
Yeah, so this is a React component which opens up. So the UI is different from what it was previously. We have also added the feature of printing forms. So you see the print button on the top. So with this, you are able to actually print any of the observations forms that you have filled out. In our case, we have configured it with the template that was required by our client.
And the allergies are always shown as red. Is that like the default? Is that a configuration, or is it only critical allergies that are shown as red?
All of the allergies are shown as red.
Okay.
You shouldn't have to refresh. It will should automatically refresh.
Yes, it automatically refreshed.
Okay. I'm saying like not the entire page, for example, only that particular display control can load up, no?
Mm.
We don't need to reload the entire page. It's a waste of resources, network times, servers, etc. Just you have only added allergy. Reload only the allergies. Kavita, I hope you are noting down.
Yeah.
I think Sohail has a question. Go ahead, Sohail.
Thank you, Ashu. So just another thing is, Amit, did you tested this page, I believe this drug administration page, after a while, it would be have a lots of dynamic content inside of it. Any test for the loading performance of this page in a poor internet area, or maybe when internet is struggling, or how long it if the content grows, any problem of loading this page or anything?
Astha, probably you will be the right person to answer that. Can you please take a stab at it?
Yes.
Yeah.
Yes, we haven't done the load testing, but this is related to one particular visit. Like, for example, this many medications and treatments won't be there in one visit. And once the visit is closed, then for the next visit, we have the fresh set of medications. Same goes for the allergies and diagnosis as well.
No, just for example, as it is IPD patient, so it's not presumably very shortly visit will be going to be closed, right? So the patient's drug administration and the other these pages, particularly the information of these pages, will be remaining for at least for a time being the patient will be in IPD.
Yes.
So it's not like if you erase, then the nurse from the next shift will not get the context of the holistic things, or even the doctor will come to the next morning, he will not able to get the context of whatever drug is already administered, what is upcoming, many things. So presuming some sort of the time, the information in these pages will be needed and it will be continuously grow. So, yeah. So I'm
Well, that's a very good point. So Astha, probably please make a note of it, and that's a really good point. Yeah, it will grow if the IPD stays longer. There will be enough information to
So,
probably
so
to create.
what is your typical duration that you are looking for at the current deployment? Is it 2 weeks, a month for the one patient admit period? Do you have any idea, Amit?
Uh, for them, the average is, if I'm not very wrong, it is maximum 2 weeks is what they said, but it probably vary. But this is how they said, maximum 2 weeks. Probably it varies, but not more
Yeah,
than that.
yeah.
Yeah.
So that definitely Sohail's question is, I guess, valid to look at, and you are going to now encounter some of these situations since you've just gone live. You will start seeing data, and depends on the patient, complicated history, especially if they have other ailments, right, like existing drugs, like diabetes history or certain other history, then that drugs along with the actual treatment drugs, so they will potentially increase. And then if 2 weeks is the duration, then definitely other information will start coming in. I think the advantage you do have though is that it's not internet based, your hospital. I think it's an on-prem deployment
Yes.
of the server. So you have relatively faster internet available because it's local. But once this goes on in the cloud or remote data center, then things could be different. So we will definitely need to plan in terms of test and load times. I don't know if you have something like Lighthouse or others that are also added as part of your components. They could help you check at least the load time for individual components, but the APIs will also need have their own effect. So I feel some level of load testing, performance testing for typical data needs to be done, like we had done for Bahmni Light. We had some, estimates and typical test done. It will eventually be needed.
And
Yeah.
related to the
And
lab,
lots of times you don't need a tons of information to show at first time. You can always like say to snapshot of data. For example, treatments, right? If the patient is there for last 1 week, right? You don't need to show the medication administered starting from beginning of his admission. You can just show for the last 1 day what he has gone through, and if required, people can scroll, and at that point of time, you can fetch additional data.
yeah, and understand that an IPD is a very dynamic, scenario where the patient is constantly improving or, deteriorating. So having a lot of data displayed at this at at a moment
Yep.
is not really required.
Yeah, it's rather confusing.
Yeah,
You want to get the snapshot of the data, the most important information at a point in time.
yeah, and there's always history though.
Yeah.
go back and look at.
Exactly. So you should leverage like, the scroll. Okay, I want to see what happened yesterday. Like, for each of these controls, I'm assuming you should be able to see that. But make sure that like, at a point in time, you show a snapshot of information. You don't have to show the entire history. Nobody's interested what medications the patient took like, 7 days back.
Sure, sure. That makes sense. Yeah.
The allergies are all red. Yes. I think they have rash. Okay. We are over time. Um, are there more things to show, or like maybe Amit, Avinav, you guys can talk about what's coming up quickly?
Yes, also. So, Asta mostly covered whatever we have developed or went live, and there are actually a few other things coming up. For example, continuous medications like intravenous, infusion, injection, or inhalation. How we'll be uh, making changes in the medications page and how it is getting impact will be impacting in the existing downstream add to drug chart and administration. So that is one thing coming up. We are going to have a completely new ward level patient dashboard where for a specific ward, the summary view of the list of patients and their corresponding medication and non-medication tasks so that warden can look at it and plan, or even the individual nurse can look at it and plan for his or her day. That is another thing. And another one is the non-medication task. So far, we have covered the medication tasks except these continuous medications like intravenous inhalation. So non-medication task will be also coming up predominantly for our client. It's like upon patient admission, fill up certain forms. In every shift, do the nursing reassessment or other certain forms. Along with that, we will be also giving them the provision to add certain ad hoc tasks. So it will not be very specific or structured or specific values they'll capture, but they will be we'll be giving them a free text so that if they want to schedule something for their reminder purpose, they can do that. So these are the mainly three things which will be coming up in the subsequent iterations for our subsequent go live.
Super. All right. Any questions for Avinav, Asta, Amit, Kavita? I know there's a lot of to digest, and we'll upload the video. Maybe you guys can comment on it. And if you would require further clarification, maybe like, we can have further discussion or I know there is a lot of technical aspects that are probably skipped over there. And specifically for implementers, you probably want to know about configurations and other things, but maybe we can cover that like, in subsequent sessions. So any questions for the team? Okay. So team, thank you. Thank you for all your work. This is like an amazing, I think like now we are getting into full-fledged like, hospital usages with all the, IPD nurses schedules and things like this. So this is great. Thank you for the great work. So thanks everybody for joining in. Right, I know it was 20 minutes over, but I hope the time was well spent. Please provide your feedbacks, and we'll see you next week, same time, 6:30 a.m. IST, 1 p.m. UTC. Till then, stay healthy, stay safe. Goodbye.
Thank you.
Thank you.
Thank you.
Thank you.
Thank
Thank
you.
you, Nidhan.
Thank you.